You are listening to the IoT For All Media Network.
Hello, everyone, and welcome to another episode of the IoT For All podcast on the IoT For All Media Network. I'm your host, Ryan Chacon, one of the co-creators of IoT For All. Now, before we jump into this episode, please don't forget to subscribe on your favorite podcast platform or join our newsletter at iotforall.com/newsletter to catch all the newest episodes as soon as they come out. But before we get started, does your business waste hours searching for assets like equipment or vehicles and pay full-time employees just to manually enter location and status data? You can get real-time location and status updates for assets indoors and outdoors at the lowest cost possible with Leverage's end-to-end IoT solutions. To learn more, go to iotchangeseverything.com. That's iotchangeseverything.com. So, without further ado, please enjoy this episode of the IoT For All podcast. Welcome, Aditya, to the IoT For All show. How's your week going so far?
Good. Full of vaccines right now, but very good.
Fantastic. Well, it's great to have you here. Excited to kind of get into this conversation. I wanted to start off by just kind of having you give a quick introduction about yourself to our audience, a little background information, who you are, who they're listening to, that kind of thing.
Absolutely. So it's a pleasure to be on the show. My name is Aditya, one of the founders and CTO at Luma Health. We are a patient engagement solution, and our vision and our goal is to take healthcare out of healthcare. So make it easier for patients and doctors to connect around the moments that they know they need to get access to care, and make it as seamless and as joyful as it can be when you need to get access to care experience along the entire journey a patient goes through. So we're based in San Francisco. I live in this beautiful city and been at it for almost a little over 6 years now.
Fantastic. So let's talk a little bit more about the company, what you all do, kind of the role you all play, how IoT kind of fits in and that kind of thing.
Yeah, absolutely. So Luma Health, kind of what we aim to do and what we have built a solution, a platform that enables healthcare providers and clinics and health systems to do is communicate with patients and then help them get access to care. So the kind of talk track we often use is, I know, me, Aditya, you, Ryan, you need to get access to care. So how do you go about that journey in order to get access to care? Find the solution you're looking for, and then kind of make sure that everything that your care plan that you put together with the doctor is well tracked, well traveled, and actually well understood on your path to healing. And so one of the very common examples we like to give in this universe is, if you're a potentially diabetic patient, one of the largest causes of healthcare consumption in the United States, being able to measure your blood glucose on a every day, every hour, minute basis is super important so you can make wise and smart choices in how to manage your chronic disease. And so that's one of the really interesting ways that we've started to see IoT specifically really show up in a very prevalent way in healthcare. So Luma's goal is really to help the patient orchestrate that entire journey. And, from the point they're like, I think I need to go see a doctor. Is this the right doctor to see? Booking that appointment, and then making sure they have all the preparatory information and then the post-care discharge information. And then, potentially as things happen down their care plan, for them to come back in for follow-up care. Okay.
So as a co-founder of the company, tell me a little bit more about the story behind it, kind of where this idea came from, how the company got started, what opportunities you see in the market to kind of bring this solution, I guess the technology first to life, and then obviously the solutions you have out available right now.
Yeah, when there's three co-founders on our founding team. Myself, my story is kind of in some ways a very boring Silicon Valley technologist. Worked at Adobe and Microsoft, and then venture-backed startup. So about as cookie cutter of somebody in the Bay Area as you can get.
Sure.
And then my other co-founders, one is an MD, Dr. Ekram, and he a lot of what we came through and a lot of the ideas that we built here were really around his experience as a clinician. And my other co-founder, Adnan, who's a biologist. So really, from Dr. Ekram's perspective of being a practicing radiologist, one of the biggest things that he saw, and when we were kind of talking at the early stages of the company, is he's a radiologist. And if you need to go get imaging, an MRI, a CT, an ultrasound, whatever it is, it's a typically very expensive appointment that's also very hard to get access to. And patients wait anywhere from 2 to 4 to 6 weeks to get those appointments, which means the beginning of their path to care and their path to healing is often delayed that amount of time. So really starting with that little genesis of an idea saying, hey, there's actually patients canceling appointments and there's patients waiting weeks to months to get access to those appointments. We really started the company on this idea that we should have a smart wait list. We should have a wait list that kind of matches patients who are canceling and patients who need appointments. And that's really where the kernel of the idea that became Luma Health came from, which is a product that was around kind of matching supply and demand. And again, with that core vision of, hey, how do I make it as easy as possible for me, a patient who needs to get access to care, to get access to that care? From there, what we ended up doing over the last 6 years is really building more and more solutions around that pathway. So now I got an appointment. Now I need to reschedule the appointment. Maybe I need to see who are other doctors that might do the appointment in this health system. Hey, I got access to that care. I now have follow-up instructions, or prep instructions before that appointment. All those different points on that patient's journey. So we started with this one really simple, core of an idea that's really blossomed into an entire platform that describes how do you get patients successful in their care plans.
Gotcha. That's fantastic. So I guess to bring this all back around to each other, and we have a better idea of kind of how the company works, how the company got started. Let's talk about some use cases out in the market. I know you have something very closely attached to what's very relevant today with the COVID-19 vaccine. So I'd love you to talk a little bit more about kind of how that solution works, what the solution is, and just kind of the overall benefit.
Yeah, I mean, it's getting Americans vaccinated is one of the largest public health challenges, that any of us, I'm sure, can ever remember. And it takes a village of technologists, hospital administrators, operations staff to really put together all the pieces to stand up a fully scalable vaccine operations solution. And that's one of the things that we've done is put together a turnkey set of solutions that help health systems deploy vaccine scheduling, messaging, rescheduling, and consent at scale. And so if you are a patient who's looking for a vaccine, for example, in New York City, maybe the Bronx, maybe Manhattan, Arizona, Chicago, the Chicagoland area, these are a couple of places where we have live deployments. We make it very easy for you to look to see if you're eligible, because the eligibility rules are literally changing every week. Every state has a slightly different set of eligibility rules. And so these are fast moving targets that, patients are aware of because they hear it in the news, but they're not necessarily always sure if it applies to them. So that same idea of I'm a patient who wants to get access to this, service, this vaccine. Am I eligible? Finding if they are, showing them an open slot, letting them book it. And then when it's time for their appointment, sending them information about the vaccine, things to expect on site. One of the really challenging ones we're seeing, as we're talking right now, Ryan, is the snowstorms that are happening kind of throughout about a third of the United States.
Sure.
And so one of the things that's really become important in the last kind of 2 days and probably the next 6 or 7 days is we're having to actually message patients to make sure they bring clothes to their vaccination appointment that they can actually roll up their sleeves. Right.
Interesting.
It seems so trivial, but if you're in long johns, a parka, all this sort of stuff, the amount and speed at which these mass vaccination sites can move patients through slows down quite a bit, and which means we're vaccinating primarily seniors, which means if the actual indoor vaccination facility is backed up, that means senior citizens are waiting outside in, single digit weather. So kind of getting patients prepped ahead of that kind of visit so that they're make sure you wear something that can be rolled, that you can roll up your sleeves, and then having them book their dose 2 appointments when that's done. That's part of this operations flow that we've built out that makes it really easy for them to step through all the pieces of, am I eligible? I got it. I know what I need to do. And when I'm done, I got my dose 2 appointment in 28 to 48 days later. So there's all those pieces around coordinating that, where you want to bring the speed at which you can move patients through the vaccination centers is critical to making sure we can deploy all the supplies that exist.
Gotcha. Well, that's fantastic. So I wanted to take a step back here for a second and just kind of lay the landscape out a little bit more for those who may be a little bit unfamiliar with how technology is playing a role in the healthcare space. And just from your experience, how has healthcare technology, and this is not necessarily within hospitals, but actually performing services, but more as it relates to companies like yours who are building solutions that are applicable to the healthcare space to kind of just help out there. How has healthcare technology kind of been developed in the past, and kind of where is it, I guess, in a sense now? How has IoT enabled healthcare? Or I guess solutions that are now helping the healthcare world, and kind of what does that look like?
Yeah, it's fascinating to see the evolution of health technology, and I'll kind of even bring the tape back a little bit earlier, Ryan, and kind of talk, where you saw in kind of and you kind of saw in the consumer internet, to kind of use that as a grounding principle or grounding place here, that transition from like Windows applications to web applications to, connected device and mobile applications to now like IoT applications, right? And so there's this evolution that's happened or happening in consumer and general enterprise software, where we're starting to see those kind of pieces come to bear now in healthcare technology and health IT, as we call it. And one of the really important parts I think that we found here is we're just now like, healthcare is huge, right? It's so big, and it's such a some parts race forward so fast. Like the vaccine is a miracle of science, right? Versus like you have to VPN into a virtual desktop in order to get access to a healthcare record, right? And so, kind of how do you marry that with kind of like the other pieces of like an IoT and an internet like enabled set of like remote device monitoring and all that sort of stuff and internet enabling devices? There's so many pieces that are like where the gears are still turning and they're not necessarily matching very well. And so one of the pieces that I think that's been a really positive sign and kind of how the evolution of technology has really moved us forward here and will continue to move us forward is partly in healthcare. This is very unique, is the regulatory pieces.
Sure.
The government has put a lot of effort into what's called the data blocking rules, which say you, Ryan, me, Aditya, as a patient, we have the right to our own medical records. We have the right to access them. We have the right to kind of put them in my Apple Health Kit. I have the right to put them in, these other systems and capabilities. And I think there's this regulatory shift that has caused a lot of the vendors in the health IT space to really move to embrace APIs to enable this IoT remote patient, internet connected experience that really exists for patients. So a really great example, and I use this, we talked about this at the beginning of our dialogue, which is in diabetes. If I have a glucose monitor, being able to see my, my blood glucose on my phone is super valuable. But how do I tell the clinician about that? How do I tell my doc about it?
Sure.
How do I have my doc actually do something actionable? So we have some really interesting customers who do some really interesting stuff here. And it's kind of, there's this confluence of like this regulatory changes around how telehealth becomes more pervasive in healthcare and remote patient monitoring, which is kind of like that concept that covers IoT in healthcare. These really come together. So one of our customers, Dr. Madhavi Jogi in the Houston, Texas area, he does this really powerful thing where he's kind of monitoring these patients. But then when he actually does a telehealth visit with them, he'll actually get them on the video and say, now I want to look in your fridge. Right. Let's actually have a discussion about like what these things that we saw. And actually, it's not just a, hey doc, hey patient, how's it going? Hey doc, it's like this. It's like, okay, let's actually dialogue about how these different pieces come together. So that your behaviors, that's things I'm seeing remote, they're tied into APIs that are getting back into your electronic healthcare record. How these pieces really tie together so that I can provide a patient with like a more comprehensive path towards their care.
Gotcha. Yeah, that's we've been seeing a lot of very unique kind of applications of technology in the healthcare space. It's been a very fascinating kind of, path, or we've seen over the last number of years, especially as IoT kind of relates to it. We're seeing everything from asset tracking solutions to solutions just like yours, or actually your solution, not solutions like yours, but your solution. And I wanted to ask, because I've had this conversation with some other people about just the general roadblocks and challenges that they've come across in the development of solutions and working in a hospital setting, building for something that does have a relatively large number of regulations involved in it and privacy concerns and that kind of thing. So as you've kind of got into this space and you started down this path of building the company and your solutions, what have been some of the biggest challenges that you've come across in that process, and kind of what does that look like?
Yeah, it's access to data. That is number one. Any technology vendor working in the healthcare space, access to data and access to data in a HIPAA compliant manner.
Right.
So anyone else in this ecosystem, like you have to be good stewards of the patient's data. That's your responsibility, right? It's your moral responsibility, but it's also your legal responsibility. And being able to stand up a HIPAA compliant system, service applications that also then marry the other big challenge of actually getting access to the patient's data, whether it's through APIs, through common standards like FHIR or HL7, or through some really legacy technology such as, like, you'd be amazed in healthcare, the state of the art often is I'll send you a file over an SFTP and then we're good. You're like, okay, well, this is like not very different than where we were in 1977 or something like that. And so being able to, transact that data in a HIPAA compliant manner and just getting access to that data, that is by far the number one biggest challenge in kind of how do we move the state of the art forward.
Gotcha. And now kind of tied in a sense to the biggest challenges that you've seen. What about like, as far as trends go, like what are you seeing kind of happening in the market? What are some of the, the biggest ways technology has kind of enabled these solutions to now be possible? I assume, obviously with mobile phones, it's playing a big role. The technology being available to monitor patients remotely, and that again ties back into IoT. So on the positive trend side, what are some positive trends that you're seeing? And then also, I'd be curious to hear more on the negative trend side. Are there any kind of concerning trends that you're seeing, or maybe you have seen that technology is allowing to kind of be fixed now?
Yeah, on the positive trend side, I think really the big focus that I'm seeing is the patient is now moving into the role of a consumer. Mm-hmm. Like use your iPhone to do your banking, like, being able to access your medical records seems to be an equal expectation that patients should have. And I think putting the patient really in the driver's seat of their own healthcare experience is making health systems actually realize that they have to up their game.
Sure.
And, a lot of times people kind of, I think somewhat pejoratively say like booking an appointment should be as easy as booking an airline ticket. And I like that because it tells the right story, but there are really only 4 major airlines in the United States, right? Versus here in the Bay Area, I have 4 major healthcare systems and then maybe a couple thousand, small clinics and practices. So the vision is right. The analogy is wrong, if that makes sense. But I think that same thought process of, hey, the patient is in that driver's seat is that mega trend that is really a force for good, because we will all be pulled by like patients who say like, hey, you know what? The app for health system A is a pain in my rear. And I'd rather go book even at health system B because it's easier to get my access to my appointments. I can text my doctor. I can do all my screening forms online, and they send me, and I can directly submit my, blood glucose, my BMI readings, whatever it might be. And so, I might drive the extra 15 minutes because it's just easier to deal with. You see that all the time with other kind of consumerized behaviors. And so I think it's really going to push health systems and clinics to really move towards a more consumer-friendly, or patient-friendly way of deploying their services, the delivery of their services. And that's a real concept of getting healthcare out of the way of healthcare. Patients love to see their doctor, right? Patients often, very rarely do patients have something incredibly negative to say about their physicians themselves. It's often about the delivery of the care that surrounds that physician appointment, where a lot of the angst comes from. And so I think that patient expectations is a really positive trend where, the demand for patients for a great experience is the same as the demand for a great experience when they're booking an airline flight. So I think that's a really positive trend.
So let me ask you this question. So I know with healthcare, obviously healthcare spans all ages. And if we just think from, when you're kind of, I guess, an adult, so 18, 20, 22 years old, to, the elderly, technology, if you remove healthcare, is used very differently by all these different age groups. And as, hospitals and doctors' offices bring these kind of technology and these services to make the patient's interaction, the patient's experience better, how have you seen kind of the adoption and the, I guess just generally the adoption based on or around different ages? Because obviously the younger tech savvy kind of groups would love these kinds of things. I know personally I do, being able to send messages to my doctor without having to call and make an appointment, being able to schedule appointments online. But then my mom, for instance, she's not someone who is necessarily going to interact with that. She's going to want to be able to call and talk to somebody and, handle it the way she's handled it her whole life. And then you get, even older than my mom, like, the 70s and 80-year-old patients who may not be very good with technology. So a lot of these services may not be as easily understood or adopted by them. So what is kind of the approach there? What challenges have you seen or trends have you seen kind of as it relates to the varying ages of patients? Because I think this is an inevitable thing that is needed and definitely makes the process better for everybody. But just from your side of things, what have you kind of seen from the age distribution side?
And I'll add in one other dimension there before I'll make it more complicated before I answer it, which is a patient's socioeconomic background.
Very true. Good point.
The access to internet itself is not always a guarantee, right?
Right.
So when we think about it a lot, I think there's our philosophy at Luma Health, and then there's also the data, which are kind of really fascinating. So philosophically, healthcare we believe healthcare is a right. Everyone should have access to healthcare. Everyone should have the ability to get access to high quality care on the terms that make sense to them. And the ability to, what's really important is that you do not disallow certain classes of individuals, whether it's due to socioeconomic background, age, gender, ethnicity, due to a lack of access to technology. That should not be allowed to disadvantage a certain individual from getting access to care. And that means that solutions, kind of our strong belief is solutions need to work across all modalities that a patient may engage in healthcare. So whether that's showing up in person, we have to have tools and technologies that support an in-person, like whether it's a kiosk or even, a tablet. One of the questions you asked Ryan is, how do you make for elder geriatric populations? One of the things that we've learned is, geriatric populations, and they have to do an 18-page pre-assessment questionnaire in the doctor's office lobby. They may not be able to have the arm strength to hold a tablet that entire time, right? That requires a bit of arm strength, requires dexterity and requires technical proficiency. And so being able to have nurses act on patients' behalf, medical assistants act on patients' behalf, and then email also for, there's the that population who relies primarily on email, and then obviously SMS. And that's kind of being able to service patients in all different classes and have access in all those classes that's just key to our mission. Now, kind of the interesting part that we see is patient engagement rates across age groups. And the highest engagement rate that we see is in the 70 plus. Which is kind of maybe backwards than you might. Yeah, exactly. Yeah. Right?
Well, I wonder if that has to do more with the fact that the older individuals probably interact with doctors and more than the younger generation. Like I know for instance, I don't see a doctor very often. I mean, even over the last number of years, I see them only a handful of times, but I know as you get older, just naturally you go to the doctor more.
And that's definitely a factor. Your consumption of healthcare increases generally with age, right?
Right.
And then the acuteness of your requirement to get care goes up with age too, right? Like it's more like if you decide not to go in for a sore knee or a sore back, it's not really a big deal. But if you don't go in for your diabetic exam or your glaucoma exam, there can be pretty significant downstream effects for you. So there's the acuity, as they call it, the acuity generally speaking goes up with age. So I think that's one of the reasons we see it. Also, I think one of the other reasons we see it is, I've spoken to, a large number of our clinics, their patients, and, texting at the 70 plus mark is so common, largely around sending children's pictures, right? So they're used to texting their kids, their grandkids, all that sort of stuff. And so there is a large amount of familiarity with using text message, a lot more so than say email, right? And so, there's just a really nice, I think, benefit there where those patients do need to get access to care because of the acuity, and kind of elder patients, geriatric populations need more access to care or need more care. And also they're also used to messaging other family members, and it's a method that they use to stay in touch. So I think you get a nice little Venn diagram where it gets quite Venny, if you will, there.
Right. Yeah, no, that makes a lot of sense. I was just curious, kind of get your thoughts on that because, we see that in all industries. Like the adoption varies depending on, obviously the industry itself, the age groups of the intended users, socioeconomic status is another one. That's a very good point you brought up. So, but I think it's probably even more profound in the healthcare space than it probably is in a lot of other spaces. So I appreciate you sharing those insights. Now, one thing I do want to do kind of before we wrap up here is just there are a lot of different ways companies can play in the healthcare space as it relates to bringing IoT in to help with any aspect of healthcare, even if it has less to do with patients and more to do with operations within hospitals. IoT is playing a pretty big role. So
critical role.
Exactly. So as you kind of look forward into kind of the next 12 to 18 months, what do you see as kind of the biggest, biggest happenings, biggest things, I guess, maybe even on your own side are looking forward to happening in the industry to make adoption increase in the healthcare space? And then after that, I have one follow-up question to kind of ask.
Sure. I think we are still in the age of COVID-19, still in the age of coronavirus, and that's 18, 12, 28 months, 24 months. Hard to know when that age will have its bookend chapter. But I think a lot of what the innovation we'll see in the next 12 to 24 months, to call it, will be around managing healthcare in that context. So whether it's, one of the great applications of IoT, and I think this is just so powerful, is in pharmacy. These Pfizer and Moderna doses require such specific temperature controls. And then if there's and we've all seen the news in the news. Sure. In the stories in the news, where fridge failed, like racing to get like 300 patients in the door so that we can get them vaccinated, right?
Right.
So like remote monitoring of like temperature, of supply, of connected devices along those dimensions. I think that's so important. Those are going to be a really big part of what that is. Coronavirus testing, COVID-19 testing is still going to be a really important piece there. And there's so much in that space around consumable supplies that get used in COVID testing. And so being able to monitor those with like IoT enabled, drawers, IoT enabled supply cabinets, IoT, all these different sorts of things. And then I think the conversation with IoT often is how to make heads or tails of the massive volume of data that it generates, right?
Right.
And so I think that's going to be one of the big challenges of getting that piece together, which is being able to build telemetry, real-time telemetry, to make kind of decisions based on that. So, one of the other, I am by no means a hospitalist, so I don't have a really great context here, but managing hospital infectious disease and hospital sanitization protocols using IoT seems like such an easy place to like actually make a really positive impact as, patients who are coming with COVID-19 need to get treated and then it needs to get sanitized after. Being able to manage that automatically seems like such a possible, like great way to do real innovation that helps real patients.
Absolutely. I totally agree with you. And the last question I have for you is, so, for those companies or individuals, looking to whether it's adopt IoT or build something for the healthcare space that is connected to IoT, is kind of playing in the digital transformation space. What advice do you have for those companies entering into the healthcare space or looking to adopt IoT that are already in the healthcare space?
Where does the data go? Where does it come from? Where does it go? Okay. Healthcare is so challenging in this way because a patient's stay at a hospital generates gigabytes and gigabytes worth of data, right? Multiplied by hundreds of thousands, by millions of patients. But also making sense of that information in the first place requires data in, not just data out. And so I think that's the most critical question here is what do I get the input streams of data to really make it make sense for that information? And then for the IoT driven data sets that are coming out. And then once I get those IoT driven data sets out, how do I put it together in a way that makes sense for either hospital operations or clinical care? I think those are the big questions that anyone entering the space should start their dialogue with. Okay.
Yeah, that's fantastic. Really appreciate that. We have a lot of, we've had a number of guests on that talked about healthcare related solutions in IoT. And on just our site in general, we have a lot of healthcare related content, see a lot of good traffic around healthcare related topics. So this has been fantastic. I truly appreciate your time. Now, if our audience out there is kind of interested to learn more about you, your company, kind of your offerings, what's the best way that they can find out more as well as reach out if they have questions?
Absolutely. Anytime, www.lumahealth.io. Find out more about Luma Health, myself, the company, the rest of the team, and our customers there.
Fantastic. Well, I really appreciate your time. This has been a great conversation. Thanks for doing this and look forward to hopefully having you back at some point in the future.
Absolutely. Thanks so much, Ryan. It's been super fun.
Awesome. Great. All right, everyone. Thanks again for joining us this week on the IoT For All podcast. I hope you enjoyed this episode. And if you did, please leave us a rating or review and be sure to subscribe to our podcast on whichever platform you're listening to us on. Also, if you have a guest you'd like to see on the show, please drop us a note at ryan@iotforall.com and we'll do everything we can to get them as a featured guest. Other than that, thanks again for listening and we'll see you next time.